Welcome to the How to Use TYVASO DPI video. We are going to walk you through how to use your TYVASO Dry Powder Inhaler, or DPI, in 3 easy steps. Open, load, and inhale. First, select the TYVASO DPI cartridge for your dose. After confirming your dose, tear off 1 strip of cartridges from the blister card. Do not use the cartridges if the expiration date on the strip has passed. Remove a cartridge from the strip by pushing on the white plastic to push the cartridge out, checking that you have the right cartridge for your dose. If refrigerated, cartridges and inhaler should be left out at room temperature for 10 minutes before use. Now it's time to load the cartridge. Place the inhaler on a flat surface and open it by lifting the mouthpiece to an upright position. Place the cartridge in the inhaler so that it lies flat, with the cup facing down, and the pointed end of the cartridge lines up with the pointed end of the inhaler. Close the inhaler until you feel a snap. Be sure to keep the inhaler level now that the cartridge is loaded to avoid loss of the TYVASO DPI powder. You're ready to inhale your dose. First, remove the mouthpiece cover. Keeping the inhaler level, pick it up and bring it near your cheek, but not in front of your mouth, and exhale. Next, place the mouthpiece in your mouth, closing your lips around it to form a seal. To help prevent blocking powder with your tongue, tilt the inhaler slightly downward while keeping your head level. Finally, inhale deeply. Remove the inhaler from your mouth. Hold your breath for as long as you comfortably can. Then exhale and continue to breathe normally. 1 breath per cartridge is all it takes. To finish with your dose, replace the mouthpiece cover, open the inhaler, and discard the cartridge. If your dose requires you to inhale multiple cartridges, repeat the steps beginning at loading the cartridge. You're done with your dose of TYVASO DPI. Be sure to take TYVASO DPI 4 times per day while you are awake, about 4 hours apart, exactly as prescribed by your healthcare provider. If you miss a dose, take it as soon as possible at your usual dose. After 7 days of use, throw away the used inhaler and replace with a new inhaler. For additional information, please refer to the TYVASO DPI Instructions for Use Manual.